After assessing the overall appearance of the patient, the face will be assessed for facial asymmetry. The best way is to put the patient in front of the examiner. After that, we'll start to assess the facial skeleton symmetry. The facial skeleton should be palpated in case of any recent history of trauma. The bony skeleton should be palpated in this manner. First, we start to palpate the periorbital rim. After that, coming to the malar eminence, which will become flattened in case of trauma. Thirdly, contour of the nose. Nasal bridge will be deformed and will feel crepitus in case of nasal fracture. After that, coming to the TM joint, which is coming just in front of external auditory meatus. Then we start to examine the parotid area, just pre-auricular areas. Also, in case of any moles, it must be examined carefully. So these are the basic points for facial skeleton examination. Let us see it on normal subject. For facial examination, we must look for facial asymmetry. First of all, the examiner must be in front of the patient. We start to manage to say for any facial asymmetry, especially in history of recent trauma. First of all, we start to do palpation for infraorbital rim. And after that, palpation of the malar eminence. Could be any flattening in case of trauma. Nasal bridge will be flattened or deformed and will feel crepitus in case of fracture of the nose. Coming after that for maxillary sinuses. Maxillary sinus will be palpated like that. Frontal sinus will be palpated just here in the medial aspect of the canthus. That is the area of the frontal sinus which will be tendinous just in case of acute sinusitis. For TM joint, we palpate it by the palm of the 3 fingers and just in front of the external auditory meatus, asking patient to open and close his mouth freely. Please open and close your mouth. While opening and closing, we can feel how is mobility and if there is any tenderness or pain for the patient. Going to the parotid area, we can look for any swelling in the parotid area, just in pre-auricular area, together with pre-auricular lymph nodes, which can be appreciated well in this area.